The first thing that we're going to look at is who is this video content for? And the best way to look at it is if you are in a doctor's office and that doctor comes forward and says, Mrs. Smith, Mr. Smith, I have horrible news. You have a condition and it's called blank. So it may be called high cholesterol, hypertension, you're at risk for a heart attack, you've had a stroke, you have cancer, you have fibromyalgia syndrome, you have bursitis, you have whatever that may be. Here is your condition. There are 3 different ways you can respond to that. The first way that you can respond is you can ask for a pill. And basically what you're saying to the doctor is, fix this for me, and in exchange for me getting the least amount of symptoms and you taking the pain away, I'm willing to put forth this amount of effort. I'm willing to take a medication. I'm willing to take a pill. And if that's the case, the following video content is not for you. So the second response is the person that says, doctor, just tell me what to do, I'll do anything. And usually when we see that, really what happens, what that person is saying is, doctor, you know everything, I know nothing. Please tell me what to do. And oddly enough, people who say that in the beginning very rarely follow through with the plan of care because they're grasping at straws everywhere they go, and they'll do everything and everything and end up in the end with no result. If that is you, then again, this content is probably not for you. The third type of response is what we call a searcher. And a searcher is basically saying, yes, doctor, give me the best information that you have. I want all of the best information that I can have so I can make the best possible informed decision for my own health, because I know that I'm responsible for my own health, both financially and both from a control standpoint. So a searcher will generally use this format, and it's a 5-step process, and the rule is you never move on to the second step or the next step until you have failed the step that you're on. So step number 1 is this. It's exercise and corrective movement. Step number 2 is hands-on physical therapy or hands-on therapy. So it might be chiropractic care, an adjustment, a manipulation, or even massage therapy. Step number 3 is medication. Maybe topical, maybe ingested. Step number 4 is an injection. And step number 5 is surgical care. Luckily for our country, because of healthcare reform, there's this huge push right now for more and more people to take control and take responsibility for their own health. And what we are finding is that more and more people are going to conservative care first, so that is exercise and hands-on physical therapy, prior to rushing into surgery like we made the mistake of doing 10, 15 years ago. If you are a searcher, then the following video content is for you. So now we're ready to cover the 3 steps to turn back the clock on hip pain and arthritis. Step number 1 is this. It's the best exercise to do for hip pain and arthritis. And that best exercise is called standing hip abduction. That's where the person stands and they kick their leg out to the side. If you go into the video description here, there's a link that's for a PDF form and a brochure that we hand out in our clinic. It lists the 3 best exercises to do for hip pain, and there's one in there called standing hip abduction. That is the single best exercise for you to do. In the clinic, we have people do a total of 30 times. So 2 sets of 15 or 3 sets of 10 once a day. So the second step is to take a look at your diet and exercise. For diet, I'm going to recommend 2 books to you. The first one is called Eat to Live, and it's by Dr. Joel Fuhrman. You can find it anywhere, Amazon, iBooks, BAM, Barnes & Noble, wherever that may be. Very simple to read, very easy, straightforward information for you to create a life plan of nutrition for yourself so you can heal the most quickly. The second book is Timothy Ferriss's New York Times bestseller called The 4-Hour Body. Great advice in there on exercise, also great advice in there on nutrition. And all that information comes from the world's leading experts on diet, nutrition, and exercise. So check those 2 books out. The final recommendation that I'm going to make for exercise is this. People that we see in the clinic who heal the quickest generally walk as their exercise at least 15 minutes a day, 6 days a week. So it's an hour and a half investment of your time, and people who walk tend to heal more quickly. They also happen to be healthier. So if you're going to make an investment in exercise and you're not doing anything right now, the very least amount that you want to do is get yourself to a point where you can walk 15 minutes a day, 6 days a week. Step number 3 for your hip pain and arthritis is to do this. Do an 11-day test of number 1 and number 2, so the first 2 steps. If that does not work, if that does not take away your pain, then find the best hands-on PT in your area. If you're ready to fix it now and you live here in central Pennsylvania, we have licensed physical therapists here in both the Harrisburg area and also Mechanicsburg that specialize in hip pain. So you can call 717-901-9487 to schedule a free hip screening, and you need to ask for that by name. So you're calling 717-901-9487 to schedule a free hip screening. If you do not live in central Pennsylvania and cannot travel here, this is what to do. Call your physical therapist or physiotherapist if you live in Canada, India, New Zealand, or Australia, and ask this question. Does your physical therapist or physiotherapist do a grade 5 hip mobilization? You might not need that necessarily, but you need a therapist who can and is willing to do that on a regular basis. If they say yes, great, schedule with them. If they say no, keep looking. As a special bonus for watching this video, watch your email for a free book offer. If you're here in central Pennsylvania, you can contact us here at Hip Pain Specialists of Central PA, 717-901-9487. You can request a free book for your hip called Pain-Free Motion for Your Hip, Relief Without Medications, Injections, and Surgery. So call 717-901-9487 and request your free book. So that concludes the 3 steps that you can take to turn back the clock on hip pain and arthritis. As always, I hope this helps you, and happy healing.